Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness Webinar Series. My name is Anastasia Powell, and I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. You should hear audio through your computer speakers, so please ensure your volume is turned up so you may hear the proceedings accordingly. You can enable closed captioning by clicking the CC button in the top menu of the screen and click Show Captions. You can export those captions by clicking Export. In the top right corner, we ask if you'd like to receive news updates from Region 2. If so, please enter your email address and be sure to add it to our distribution list. In order to be considerate and respectful to everyone attending this presentation today, all attendees are muted. We ask that all participants keep the chat dialogue on topic and courteous to ensure everyone has a positive learning experience. Please make sure that your username is respectful and appropriate. Please see the instructions on how to change your username in the pod to the left of the poll question or Q&A pod. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Below the chat box, we have a poll question. Please take a moment to answer it before the presentation begins. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod as a PDF. You can click on the file and download it using the download button. With that, I'd like to turn it over to the FEMA Region 2 Community Preparedness Officer to introduce our speaker and today's proceedings.
FEMA's mission for the past 40 years has been to help people before, during, and after disaster. And one of the ways that we've done that is by building a culture of preparedness. At the heart of a culture of preparedness is the understanding that it takes all part of society to protect the most vulnerable, and that everyone from elected officials to an average American family has a role to play. Whether it's wearing a mask and getting vaccinated, getting connected to your community alert system, or today's topic, preparedness is a team sport, and it takes all of us to reduce the impact of these hazards and risks. Good afternoon. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2. Today's webinar will discuss how New Jersey has embraced the whole community philosophy by engaging the DAFN community, Disability Access and Functional Needs community, in its CERT program. By starting at the municipal level, these CERTs help improve and enhance emergency preparedness and response efforts, from helping individuals with DAFN create personal preparedness plans to ensure accessibility is restored following disasters. Strategies on how to best involve and serve individuals with disabilities, access, and functional needs in relation to the CERT program will be discussed today. Our guest speaker is Kelly Boyd. She is the Access and Functional Needs Planner for the New Jersey Office of Emergency Management. Previously, she served as the AmeriCorps Program Officer for the New Jersey Commission on National and Community Service, and as the Disaster and Disability Services Coordinator for the New Jersey Governor's Office of Volunteerism. Ms. Boyd was also a disaster reservist for FEMA Region 2 and an emergency management specialist at the New Jersey Division of Developmental Disabilities. Before I pass the mic to Kelly, I'd like to welcome Subha Tai, the president of the National CERT Association, to say a few words this afternoon.
Thank you, Debbie, and thank you, FEMA Region 2. Thank you, Debbie, and thank you, FEMA Region 2, for partnering with the NCA and Cal OES on another conference webinar series. We are very excited to offer some of the most popular sessions from the 2022 National CERT Conference in Galveston. The 2023 National CERT Conference has been set, and it will be in the San Francisco Bay Area in California, June 26th to 28th for pre-conference, and June 28th to July 1st for main conference. This year, we are excited to plan an exercise component during the conference, and we're hoping to offer a rodeo. And we're also exploring the opportunity to have CERT volunteers get their task books signed off at certain stations, as well as to train people on how to sign off on task books. FEMA rolled out CERT resource typing a couple of years ago, and I know a lot of programs don't know how to properly complete the task book portion, and we're hoping to include that during this year's conference. I'm going to include a link if you want to sign up for an email list to get conference updates. And thank you very much, and I'll turn it back over to Debbie.
Thanks, Yuval. We're looking forward to the conference this year in the sunny state of California. And with that, I will turn the mic over to Kelly to begin her presentation. Kelly?
Thank you, Debbie, and thank you, Suva. I am very honored to be a presenter today, and I am extremely impressed with the turnout. And thank you to the New Jersey CERT members and other first responders who have joined as well. If you have any best practices you would like to add, feel free to do that as I go through the presentation. This presentation typically does come with a manual, which I'm sure Suva can comment on later, but we are working on updating that as well. This presentation was created in 2018 by myself and now retired Lieutenant Brian Trexler, and we have been giving the presentation throughout New Jersey to different CERT organizations and at the rodeo, and decided to update it not long ago. So what you're seeing is the newest version, and hopefully everyone will learn something today, and certainly take what applies to you and feel free to add to it. So, okay. So again, it is called Responding to the Disabilities and Access and Functional Needs Community. And in New Jersey, we don't just preach about how to respond to the community, but we also encourage the CERT programs to include people with all types of disabilities. There's something for everyone to do. So being this is a webinar, I will skip the introductions. You've heard a bit about what I do. Also, I was diagnosed with juvenile rheumatoid arthritis when I was 2. I use a wheelchair, a motorized wheelchair predominantly, and sometimes a manual, also at times a walker. So I sort of have experience on both sides of the fence. And having a disability, I'm also a CERT member in Mercer County, and have worked with the CERT program at the New Jersey Office of Emergency Management for a number of years, just providing DAFN guidance and training as needed. So if you had the manual in front of you, we would be going through Unit 1 right now, which is Disabilities and Access and Functional Needs, a course introduction and overview. And the purpose of the course is to raise awareness of the disaster-related needs of individuals with disabilities and access and functional needs, which we'll go through what that means. Course participants will be able to determine how to integrate the DAFN, or some folks call it DAFN, community into their existing programs. So if you're a CERT leader, this will be of specific interest to you. Better serve individuals with disabilities and access and functional needs, and decide if additional activities are needed to enhance disaster preparedness for this sector of the community. Part of the reason I'm reading the slides today is that I know some folks on might have visual impairments, so I want to make it easy for everybody. Okay. By the end of the course, participants should be able to define and provide examples of categories of functional needs as listed in the National Response Framework, NRF, discuss the basics of disability etiquette and person first or people first language. Typically, if you were in my class, you would get a handout, and we could certainly send that out to everybody in this group. Also, list the unique challenges that incidents place on the DFN community. Discuss how disaster preparedness measures can be adapted for people with DAFN. Outline examples of how CERT can enhance DAFN preparedness, response, and recovery efforts, and explain how CERT can partner with the DAFN community. And just a quick little story. I did get a call the other day from someone who may be on here about an incident where he was talking about DAFN projects and initiatives, and someone called him out on a term using the word vision issues and whatnot. So this handout is a great guide to help folks understand what is politically correct, if you will, and putting the person first. So Unit 2, if you are going through the book, is an introduction to the DAFN community. On the left, there's a picture that says deaf section. That was from a shelter during Katrina, from what I understand. Folks were asked to gather in that section so information could be shared more easily. There were some questions about whether that is discriminatory or the proper thing to do, and what I was told, it was actually easier because folks who are deaf were able to better communicate with each other. I see my colleague Arlene online. If she'd like to add anything in the chat, do feel free. And so that's why that picture is up there. The other picture is what we call sort of a no-no, or something we hope to avoid. And the reason we work so hard to help people prepare when they have a disability or excessive functional need is so they avoid having difficulties evacuating. This gentleman here, you know, we can't really know the exact circumstances, but if you know a storm of a large nature is coming, we encourage people to get out as soon as possible so they don't end up in a life-threatening situation, or even this gentleman is probably now sitting in very dirty water that could lead to other issues. So, you know, hopefully by following this workshop, you'll be able to help others learn how to prepare ahead and hopefully avoid something like that. So what is a disability? Well, first of all, the Americans with Disabilities Act, or the ADA, defines a person with a disability as someone who has a physical or mental impairment that substantially limits one or more major life activities, such as self-care or the ability to learn. For me, that means I have a personal care assistant, or PCA, or an aide, there's many terms, who helps me in the morning with things like grooming, getting breakfast ready, brushing my hair, things like that. And once I'm ready to go, I'm off and running to work, and they do not typically come back for the rest of the day. So they're there sort of to help me with a few things in the morning and get going. Some people like myself have disabilities. You can see, for me, you see the wheelchair, you see that I have some damage to my joints from the arthritis, and others may have a disability you cannot see. I'm going to pick on Arlene again. You would not know that she has hearing loss. So unless you could, you know, some folks, it might be more obvious. You could see hearing aids or things like that. Others you cannot see. Also, learning disabilities like dyslexia are not as obvious when you're looking at somebody. So please keep that in mind. And there are many types of disabilities that could fall into that category. Okay.
Hey, Kelly.
For those who are, yes.
I do see a few participants in the chat box asking if you can turn on your camera so they can do some lip reading. Are you able to turn on your camera? If not, it's totally fine. But I do see that a couple people are requesting it.
Stacy, am I able to do that?
She's moving some things around in the room now. All you have to do is click start my webcam.
Yep, it's off to the top left. You should be able to click that one.
Okay, bear with me, everybody. I'm going to try to adjust my camera a little bit, and I will do that. Okay, one moment. And is there captioning all available as well?
Yes, captioning is on, and for future reference, if anybody needs an accommodation, if they could let us know in advance, we're happy to set it up in advance.
Okay, I'm going to try to do this. Let's see. I gave access on my end.
Thinking about it.
I'm not sure what the issue is.
You don't have your camera covered at all, do you?
Let's see. Hang on. I have, let me, because if everybody can bear with me, let me check. Because this, there's a camera that kind of slides down. Let me see if I can get that one. All right. Good. Sorry to everybody here. Oh.
So don't be shy and request that accommodations if needed. Thank you.
I'm going to adjust it one more time and see if it works this way. Because it's the computer tilts.
It's on, but it looks like it's frozen.
Yeah, I paused it. Let's see. Okay. So hopefully, is this any better for everybody?
It looks fine to me, Kelly. So I think any additional assistance would be good. So, and just to remind everyone, the CC button is on the top of the screen, and it will scroll real time while Kelly's speaking. Thank you.
All right. Okay. So the National Response Framework, or NRF, is a guide to how the nation responds to all types of disasters, and it breaks the term disability down into a function-based definition, wherein disabilities and access and functional needs reflects the capabilities of the individual and not their condition, label, or medical diagnosis. So before, during, or after an incident, members of the DAFN population may have access and functional needs in one or more of the following areas that we refer to as CMIS. And that's C is communication, M, maintaining health, I, independence, S, support, safety, and self-determination, and T, transportation. And I'll go through this briefly. I know it's a lot of information, but eventually I do believe you'll all be able to get a copy of this. Communication refers to individuals who have limitations that interfere with the receipt of a response to information and alerts and things like that. They will need this information in accessible format so they can understand and process the information they're getting. Folks may not be able to hear verbal announcements, see directional signs, understand how to get assistance due to hearing, vision, speech, cognitive or intellectual limitations, or due to limited English proficiency. The type of support that might be needed could be interpreters, sign language interpreters, language or translators, hearing aids, message boards, electronic devices, and websites also need to be made accessible to users. They need to be compliant with Section 508 of the Rehabilitation Act of 1973. And just as an example, that was something we worked hard to do in New Jersey during the pandemic, especially when we were constantly providing updates early on when COVID hit. Okay, maintaining health refers to those who are not self-sufficient or who do not have adequate support from caregivers, family, or friends, and they may need additional assistance. Some of these individuals may have the need for help to manage unstable conditions, terminal or contagious conditions that require observation and ongoing treatment. Some may need help managing intravenous therapy or tube feeding, monitoring vital signs. Receiving dialysis is a definite issue. We've dealt with that a lot in New Jersey as well. Also oxygen and suction administration, wound care, and then operating power-dependent equipment to sustain life. So these individuals may need help from trained medical support professionals, and that's something we're going to talk about a little bit later on. Independence. This is similar in that it refers to individuals who require support to be independent in daily activities. And so, for instance, if we have a bad snowstorm, my personal care assistants may not be able to get to me if they can't travel the roadways due to heavy snow. So then I would definitely need to make sure I have a backup plan or I have evacuated ahead of time. Also, this could include supply, durable medical equipment such as a motorized wheelchair, oxygen, and caregivers. Support, safety, and self-determination. Again, similar in that during an emergency situation, folks like myself might lose the support of their caregiver, or I do have family nearby who can help, but occasionally they're out of town, or maybe they wouldn't be able to get to me. Also, you have individuals who have autism, dementia, or other conditions like intense anxiety or schizophrenia, and they may not be able to cope in a new environment if they need to evacuate to a shelter or somewhere of that nature, possibly even a hospital. If separated from caregivers, youth or even folks with dementia may not be able to identify themselves, and if they're in danger, they may not have the cognitive ability to assess the situation and react appropriately. So sometimes folks are told to evacuate and they don't want to because they just don't really understand how dangerous it is to stay behind. And that's resulted in deaths in the past, unfortunately. And we really try hard to avoid that. So that's definitely a role that everybody could help with here, is educating those in your community on how important it is to follow the advice of emergency managers and other officials. Transportation involves individuals who cannot drive or who do not have a vehicle to use when evacuation is needed. And this support may include accessible vehicles, meaning those vehicles that have a lift for a wheelchair, or those that are suitable for transporting oxygen. And then also it's important to get information out there about how to access mass transportation during an evacuation. I think many of us know those schedules can change drastically during emergencies. Okay. So barriers to communication, we've talked a bit about this already. Also, individuals who have limitations that prevent them from processing this information may really need assistance from you in various ways to provide an accommodation. And the tools are listed below. That could be a communication board, which is what you see here. And can everybody see, Deb, can everyone see the mouse? I'm pointing. The picture here is a communication board. So you can make that. No, okay. So one can buy a communication board. You can make your own. You can download them. If you Google communication boards, they have all types. And folks who have autism, folks who have who are nonverbal or nonvocal, or someone who's had a stroke, they can point to what they might need. And I've used those a few times with individuals, and it can be very helpful. You can use it for anything to allow someone to ask for water, to point that they're in pain. There's ones that have a scale to say how much pain they're in. There's a whole variety of things. You can make your own. And there's a variety of other services out there that can be used. Video relay services. You can get assistive listening devices or use special apps. Some have no fee to them, like Be My Eyes. Folks can download that app with some help and then use the app where a volunteer will come on the screen who speaks the language that they speak and can tell a person who's visually impaired what they're looking at. They can read shelter paperwork for them, anything they might need. There are a variety of things out there. Okay. Now, I don't know if Phyllis World's on here. She's one of our CERT gurus in New Jersey, but she and I put this slide together. Many people with medical or power needs can function in a general population shelter. Some may need some individuals with acute medical needs may require the support of trained medical professionals. So if they're required to evacuate, they may need to go to a medical needs shelter or hospital, but that should be based on local shelter protocols. Okay, so you'll need to find out what the protocol is where you reside or where you're involved with the CERT program. So a couple of things we talk about when I do this workshop is that some folks have alert bracelets or scan tags. What you see here is one called If I Need Help. I was, well, just to be blunt, I'm divorced, but my stepson who lived with me for about 8 years has severe autism. So one of the things we had for him was this ID tag that laced into his shoe. And it was one of the best things because he typically had the same shoes on, but not all, some people would have it clipped to their coat or their shirt, and that changes. So if he were to elope or, run off, folks with a smartphone could scan it, and they would have my contact information and could reach out to me, and we'd reconnect. Also, it's great for someone who has dementia or a related issue, well, I shouldn't say it's a related condition. Okay. Also, there are other things like Project Lifesaver, Angel Sense, many things are out there. In New Jersey, many of our counties provide Project Lifesaver, which looks like a watch with no numbers, and folks wear it on their wrist or their ankle, and if they should elope, the local sheriff's department can use a device to track them. Okay. Also, the reason I mention that too is if somebody ends up in a shelter with one of these on them, I just want you to be aware of what they are so you can help reconnect them with family members. I have actually been made aware of an incident where that happened and family members weren't ever notified because nobody knew what to look for here. So it's important to be educated on what alert devices somebody may have on them. Okay. Again, families who have a member with DFN should evacuate ahead of time. A lot of times it takes folks like myself longer to get out for various reasons. I have you could see my wheelchair there. I need to make sure my battery is ready to go, a whole variety of things. So many things I have in a bag by the door that I can just grab, but not everything can be packed ahead of time. Okay? At one point, and Debbie, feel free to jump in, FEMA had a memorandum of understanding with the National Council for Independent Living, which is an advocacy organization that promotes independent living, to provide personal care assistance to those with DFN who shelter. That, I believe, may have paused for the moment, but that was an option at one point. In New Jersey, I'm very fortunate that the Medical Reserve Corps and CERT members have taken, or many of them have taken, what is called the Care Assistant Fundamentals class, and we work closely with the Progressive Center for Independent Living and the Red Cross to offer that class to MRC and CERT members so they can be trained to serve as personal care assistants in shelters if need be. So that's been quite popular, and it's a huge need during times where folks have to shelter. Okay. Also, keep in mind organizations like the American Legion and the Rotary Club will lend out durable medical equipment like wheelchairs during times of emergencies. They often don't have a lot, but they are a resource that may exist in your community. So if you're teaching this class locally, that's a great point for discussion. Get to know what's out there and available to you. Okay. Transportation options, you should also become aware of what's out there. There are paratransit, like the one you see here, private fleets that are operated by nursing homes, hospitals, limo companies that may be available to you if an agreement is put into place. Any agreements that you put into place, make sure they're updated, okay? Maybe once or twice a year or how often you feel is necessary. And then oftentimes the state and counties and municipalities have their own fleet. Talked a lot about this. One thing we didn't mention too much about is folks from diverse cultures may have access and functional needs, especially when it comes to dietary restrictions, and then also folks with high-risk pregnancy or temporary disabilities. And then also we look at people who come into New Jersey for part of the time who may have a disability, and meaning that they only live here part of the year. We still need to make sure we account for these individuals when we're planning. And other individuals who might need response assistance could be those who've exhausted all of their other resources beyond neighbors and family and all, and just still need assistance with evacuating or sheltering. These individuals typically, like myself, as you can see, live in a single-family home or a multiple-family dwelling. They are not residents of a hospital, a residential health care facility, federally funded residence, anything like that. But really, somebody who lives in a private home. Okay? And again, the need may not be based on a medical diagnosis like myself, but on somebody's ability to evacuate or follow emergency instructions. So that's a picture of me. This is Wayne Rorda. I don't know if he's on, but he does work closely with Arlene Romoff, who's on here, and Director Elizabeth Hill from our Division of Deaf and Hard of Hearing, and then our CART provider. They have been fantastic in helping promote emergency preparedness among those who are deaf or hard of hearing, and provided videos that are captioned and have ASL, American Sign Language, to help people prepare and also sign up for the New Jersey Register Ready program. Let's see, I want to make sure I have everything now. But likely as a CERT member, you will encounter a variety, individuals with a variety of disabilities. So just please keep that in mind. One common disability in New Jersey is autism. We have some of the highest numbers there. I apologize, part of the caption got cut off, but that's Jaden. She is a very strong advocate for those who have autism. She herself has autism, and her mom is an amazing advocate as well. Autism, or ASD, autism spectrum disorder, is a complex neurological disorder that affects how the brain processes information. And we refer to it as folks as being on the spectrum because it can affect individuals in a variety of ways. Some, like my stepson was severely affected. His behavior could be very difficult at times. He was not on the same level in terms of learning as his peers were. So, you know, you must keep in mind that everybody is affected differently if they're on the autism spectrum disorder. Also, Autism Speaks, which is a national advocacy organization that you could turn to for information, refers to ASD as a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and sometimes nonverbal communication. When interacting with those who have ASD, you can pull them aside, and I don't mean physically pull them aside, but try to have them follow you to a quiet area so you can simply explain rules and procedures. They like to know what's coming up, what you know, the rules are, what they need to do. Use consistent language. Do not use literal phrases such as take a seat, because to them they may actually take the seat and not know that you meant to say please sit down. Use positive phrasing, which means telling individuals what you need them to do versus what not to do. And you can show or point to where you would like the person to go to. If possible, involve caregivers when creating plans, and be sure they understand and practice the plan. If that is not possible, try using visual aids like the communication boards or different picture boards and written schedules. And most importantly, be flexible and supportive. You will likely have to adapt plans and make accommodations. And this can go for anybody. To help avoid sensory overload, tell individuals with autism what you're going to do, what will be happening, so it can help lessen their anxiety. Be sure to arrange for a quiet space or sensory room where individuals who have autism can decompress in the emergency shelter, reception center, or similar facility. Provide noise-canceling headphones. If possible, offer a weighted blanket and a cot so they can rest. Dim the lights, they can be bothersome. And this is a great area too for those with anxiety. Also, do not touch someone who has autism without their permission unless it's necessary. Many are very sensitive to touch, and it can be painful or upsetting to them. So you don't want to agitate anybody. And that seems to sort of be a blanket rule for anyone now. Okay. I've also been working very closely with Robin Kahn from the Alzheimer's Association, and it's important to understand dementia is a set of symptoms that include confusion and memory changes that affect a person's daily life. You might notice short-term memory loss and confusion of where they're at, trouble with finding the right words, difficulty communicating, perhaps hallucinations. They might overreact or be agitated, and then have trouble with decision making. When interacting with those who have dementia who need to be evacuated or kept calm in a shelter, avoid physical restraints or force, provide one-on-one instruction, provide instructions by using simple language. Again, you can relocate the person to a quiet place or wherever they appear happiest, and use distraction by giving the person a simple task. And then be sure with individuals who have autism or dementia or similar conditions that that somebody's keeping an eye on them, okay? For more tips, you can go to the Alzheimer's Association brochure, Quick Tips for First Responders. One concept we came up with in New Jersey is to have an accommodations table at shelters and other facilities where folks who have DAFN can go and request assistance without it being very obvious. There are a lot of folks, unlike myself, who really don't want to announce their disability, and that is sort of a more discreet way we came up with for folks to get help. And I will admit, years ago, I would have definitely wanted that because I didn't really want to associate with my disability. So we really like that concept. Advice for CERT members: have comfort kits available in shelters, reception centers, police cars, ambulances, anything like that to help keep individuals calm. And again, you could have noise cancellation headphones, communications boards, sensory toys that are approved. Some of them can break and be choking hazards, so please get them from approved sources, a coloring book and crayons, a pen and a notebook, things like that. We talked about the accommodations table. Folks can go there to request durable medical equipment such as a cane or a manual wheelchair. I always advise people to label their medical devices so they don't get stolen, or if they do, they're easier to match back up with the person they belong to. Consumable medical supplies such as disposable gloves or chalks and things like that. Assistive technology, so that could be Captel phones, which you see there, magnifiers, other assistive listening devices, and things like that. Just remember, if someone's there with a personal care assistant, they should be able to stay with that person. And others may request American Sign Language interpreter and a language interpreter. And under the ADA, accommodations and equal access to programs must be provided. Advice for emergency responders. Staff may be able to reach out to state agencies, centers for independent living, which every state has. Our state has, I believe, 13. Some oversee several counties and are always there to help. Part of their mission is emergency preparedness, and other disability-related agencies to obtain resources and sometimes staffing to help as needed. Okay. We have in New Jersey certain state agencies that can lend out assistive technology for use in shelters if needed. Our Division of Deaf and Hard of Hearing has a list of qualified American Sign Language interpreters who can be enlisted to help in shelters. They were also fantastic in helping when we had the mega site vaccination clinics, and at times we could use tablets if an interpreter couldn't get there immediately, but they really worked to make sure that service was available because we realized having someone live and in person is better for communication purposes. Okay, so sometimes in the past we've had staff from our Centers for Independent Living go to the shelters and work various shifts and really focus on disability-related needs. Also, if you have an ARC in your community, I know in our area they've been willing to lend out some of their accessible vehicles, of which ours had many. They have buses, vans, you name it, and often staff that work 24/7. And then also we have counties in New Jersey who rely on Literacy Volunteers of America to help translate emergency information into various languages. And then we have a language line that can be used for translation purposes. That's a picture of one of our Medical Reserve Corps meetings. On the left of myself, Kim Silverstein, who also has a disability, uses a scooter, and she often helps me provide this training. She leads the Manalapan MRC. She's an amazing advocate. And in that day, Julie Petex, the state MRC coordinator, brought in therapy dogs to help comfort folks. It's great for shelter workers, emergency responders, and not aside from people with disabilities and access and functional needs, just anyone from MRC CERT who may have some anxiety during these situations. So that was a lot of fun, actually. This is the first DAFN CERT class in Mercer County, where I reside. I'm on the right side in the light blue shirt. Everyone in that class has a disability. One member who is a driving force passed away, but some of the other counties that are doing classes now are just fully inclusive. It's not just a disability class, and that's what we're going for now. I saw Al Grouper is on today. Al, feel free to share anything, but he is part of these programs in Mercer County. So it's a great program. This workshop can help with integrating any CERT classes you have. Oh, and then also a number of our counties are implementing senior CERT at senior living facilities and other places like that. So usually I'll ask folks in the class, how can individuals with disabilities and access and functional needs contribute to the emergency management effort? And how is your CERT program fostering inclusion and helping individuals with DAFN? These are some of the answers. That's myself and Norman Smith, who is part of the CERT program in Mercer County and a huge advocate for inclusive emergency preparedness. So the answers can vary. They can take CERT training. Someone like myself, okay, maybe I can't go participate in a search for a missing person, but I could work a registration table. This year was a pod exercise where they were pretending to distribute medication to folks who had been infected, I don't know, with something at the time. This was years ago, but we can definitely help in that regard. Norman and I have gone on tours of different sites to see if they're accessible enough to serve as a shelter or a warming center. We can serve as subject matter experts if local emergency managers or first responders have questions, develop personal emergency plans for those with DAFN. A lot of the Centers for Independent Living help do that for their clients, and advocate for emergency preparedness within the disability community, and join the core advisory groups that FEMA came up with and now we have in most counties in New Jersey. Unit 3, successfully interacting with the DAFN community. Again, be sure to use person-first language. Speak to the person, not his or her personal care assistant, unless they really are unable to communicate. Myself, sometimes people will speak to my personal care assistant or my mom or my dad. I'm very capable of answering for myself, unless I pretend I don't want to, but really try to talk to the person first. The person first language, and Debbie, if possible, if you could maybe put a link to the one that FEMA provides. If not, I can make sure folks get that afterwards. But it goes over the proper way of phrasing things. For instance, you don't want to say Kelly's wheelchair bound. You could say Kelly uses a wheelchair. You don't want to say Kelly is crippled. Kelly's a person who has a disability. You want to avoid words like retarded, different things. So the list goes through all of that. Okay. There's a few tricky parts, but one that is nagging at me a bit is usually you would say a person who has autism. Now folks who have autism sometimes prefer to be called autistic. So that can be a little bit tricky. But my rule of thumb is, do the best you can. If you're not sure, ask or apologize in advance if you think you may not be using the proper phrasing. Right? Also, when it comes to service animals, remember a service animal is not a pet. Please do not touch service animals or give them food or treats. When a dog is wearing a harness, it's on duty. And if the service animal is evacuating with their owner, they must be accommodated at the shelter. Do not separate them. Legally, they are allowed to remain together in vehicles and shelters. I'll give a nod to Middlesex County. They also provide very nice cots for the service animals. So, and some people do mats, some people do cots. Okay. A person is not required to give you proof of having a disability that requires a service animal. Service animals are not always registered. I'd love to see that one day. But if the person tells you it is a service animal, treat it as such. However, if the animal is out of control or presents a threat to an individual or others, please remove it from the site. If someone is allergic to the service animal, can relocate the person with the allergy. A service animal must be on a leash or in a harness, although they don't need to be muzzled. And guide dogs are trained to lead people who are blind or visually impaired around obstacles. So keep that in mind. There's different reasons that service animals and guide dogs might be used. Shelter staff may ask 2 questions to determine if an animal is a service animal. 1, do you need this animal because of a disability? And 2, what tasks or work has the animal been trained to perform? Here's a picture of Jamie Prioli and her husband Steve from Ocean County. They're very involved in the CERT program, and Jamie works with John Kerwin, the County Access and Functional Needs Coordinator, Emergency Manager, to run inclusive CERT programs. And examples of how CERT can help the DAFN community: some connect wellness checks before or after events. They may provide rescue signage for individuals who live in high-rises. They can conduct neighborhood visits and help those with DAFN develop emergency plans ahead of time. They could clear sidewalks, ramps, entryways of snow and debris as needed. I have a ramp. My neighbors or my personal care assistants have, made sure to get here to get the snow off. One time I had a tree fall across my ramp. Not the whole tree, thank goodness, but these are things that I've needed help with to get out. That's my only way that I can get out. And also provide messages in alternate formats. Braille is one option, large print, different languages, things like that. Also, they can help ensure shelters are accessible, and that can include clearing aisleways, following the ADA shelter guidelines, and providing easy access to food. Members may fill in, like I said, as personal care assistants if needed, and that could include offering help with cutting someone's food, helping them navigate around the shelter if they're blind, anything like that. But always be sure to ask if help is needed if it wasn't already requested. Unit 4, impact of disaster on individuals with DAFN. Again, there's somebody else who's having to be carried out of a flood zone. So what are some of the impacts of a disaster? Utility outages can affect those who are power dependent. Maybe they need a ventilator or oxygen, or myself, I rely on my motorized wheelchair to get around. If I don't have power, I'm kind of stuck. I am registered with our local public service electric and gas provider, and they know that I have a strong need for power should it go out, and they'll check on me. Issues with debris blocking entry and exits, blocked and flooded roads. We, years ago, I know some on this workshop, on this webinar will know who I'm speaking of, had a woman who was on a ventilator, used a wheelchair like mine, very severely disabled. Waited too long to evacuate before Hurricane Sandy hit, Superstorm Sandy. And the roadways became blocked and flooded, power was out, and now her life is in jeopardy. Responders barely got to her. But when you have extreme needs like that, it's really important to make plans to get out ahead of time. And this is how you can educate people as well. Extreme temperatures can cause a problem for those who can't self-regulate their temperature. That pertains to a lot of folks who are paralyzed. There can be public transportation disruptions. So I know folks who needed dialysis, for example, have had issues because their transportation provider could not get to them if there was too much snow. So our dialysis centers try to make sure if they know a storm's coming, the person can get in a day ahead or maybe the next day, depending. And there can be a loss of resources. Perhaps folks can't get to their medication, get food. So all these things have to be planned for. And then obviously damage to homes and vehicles and whatnot. I drive a vehicle with a ramp, so if my vehicle were damaged, I'm really going to have some issues because there's not a lot of other options. How could people with disabilities be impacted by disasters? You know, you can go through this question with your group before going over some of the information I mentioned. If that were my van in this day and age, I'm not going anywhere. Also, again, they could lose access to doctors, physical therapists, visiting nurses, personal care assistants, pharmacists, etc. And let's see what else. Meals on Wheels or similar services may be suspended. I know locally where I'm at, they try to provide extra food ahead of time for the person and or their pet. We also keep in mind service animals really need to have extra food ahead of time. And we've talked about the other things. We do have some sites in New Jersey that provide, that folks can go to get their equipment powered up if they can get there. And I'd mentioned Jamie Prioli before. She also, if you didn't hear the FEMA webinar in December, the gift of preparedness, what she did was ask folks for money for her birthday and holidays, as did her husband. They saved up and bought a generator. That's been very helpful for them. Okay. Unit 5, disaster tips for individuals with DAFN. I'm just going to kind of slide through this because these are things you could do if you wanted to reach out to folks in your community with DAFN and help them prepare. You want them to think about how disasters in your area could affect them and how could they adapt preparedness measures to meet their non-typical needs. Like a go bag should have medical supplies they might need, maybe prescriptions, things like that. Individuals with disabilities should have a buddy system. I have in my buddy system my parents who are around the corner, my neighbors, my personal care assistants, and a coworker. Also, my brother is in my system. He lives in Virginia. So if, let's say, I have trouble using the phone lines here, he might be able to make some calls for me there if he's not been affected by a bad storm as well. Okay, and he's also somebody I could evacuate to. We always encourage folks with disabilities to try to evacuate with a friend or family member who can accommodate their needs and know their needs before going to a shelter if possible. And what else? Also, folks will want to test their emergency plans with their buddy system. So, for instance, I think it was last year, I felt like we were Tornado Alley. We had so many tornado warnings and watches and tornadoes coming through, and my neighbors were fantastic. My personal care assistants were fantastic in checking on me and seeing if I wanted them to come get me and bring them to their house to go, take refuge in the basement. So it works well. Okay. Also, it's great to test plans ahead of time, not when the tornado is coming. Okay. And it's important that folks who have a service animal make preparations ahead of time. And therapy dogs and comfort animals are not service animals. However, I do know in some areas they will be accommodated. Okay. So plans do need to be made for them. This is pretty much common knowledge, I think, for most folks on the webinar today. Those with DAFN will need to have ways to keep informed, make sure they're getting alerts, have a plan in place, have an emergency kit, a go bag, and a kit for sheltering in place. Again, their personal support network, and the best time to do this is after they work on a personal assessment and really look at how they could be affected in their community and how they should prepare. Okay. All right. I do find, and maybe many of you do too, a lot of folks with disabilities and access and functional needs do not get alerts and don't know how to get them. So we try to get the word out as best as possible and encourage them to follow the news, as well as trusted social media sites and Twitter feeds like the New Jersey Office of Emergency Management. We have Twitter, Facebook accounts, websites, and that is all accurate, trusted, valid information, okay? Many individuals who are deaf or hard of hearing rely on social media more so than other sources, so we tried to make sure we keep that up for them as well. And they should sign up for reverse 911 calls, text messages, emails, whatever they feel most comfortable with doing. And I oversee the New Jersey Register Ready program, and it's free for folks with disabilities to sign up. They are encouraged to do so if they think they would need help evacuating. I am in the system. I have gotten calls at times to make sure I'm prepared or that I'm okay, and it's a confidential system. I have heard all the pros and cons about registries, but I do believe it really helps our emergency managers better prepare for who's in their community, okay? Folks can sign up online or by calling 211, which has translation services, and some counties use Smart 911. Talked about the Centers for Independent Living helping, and should also, folks with DAFN should also have plans where they can meet. Let's say there's a small fire in their home, maybe they want to go next door and stay there until the fire department comes. If there's a major issue like flooding in the area, they may want to go stay with a relative in a nearby town. And make sure communications plans are tested and updated, like I said. For preparing a pet go bag, have copies of vaccination records, make sure their vaccination tags and licenses are on their collar. My dog has all of that. You might want to pack a bowl, food, their medication, and a photo of the service animal with yourself in case you're separating. Also, no escape routes from your home, as well as safe places to hide inside. And before you evacuate, make sure your escape routes are safe. Couple things to keep in mind. Accessibility factors can impact preparedness. One of my stepsons said to me at one point, if a tornado was coming, how would you get in the basement? And mind you, he was about 7 and said, well, you know, this is what we do. And I told him the plan, the neighbors would help and different things. But, you know, it's great to think about these things ahead and get your family to think about it. And that's something you could talk about if you're giving this class. Again, update plans as circumstances change. These are items that are recommended for go bags for those with the AFN. We talked about some of these things, but also don't forget hearing aids and batteries, eyeglasses, repair kits, emergency contacts that include name of doctors, caregivers, transportation providers, insurance information, your pharmacy, a little bit of cash, flash drive with crucial files, keeping in mind if the power is down, you may not be able to access that. Have copies of very important documents with trusted sources, preferably out of state, maybe one in state. And I really mean somebody very trusted, like someone like my brother, not just a friend I met last week, something like that. Okay? Have a list of allergies, cell phones and chargers, power cells. They also have solar power cooler bags now that you can use for medication, anything like that. Also, support networks could include coworkers, anybody you feel necessary. Trying to make sure I didn't miss anything here. Make sure that folks on your support network list are checking on you. And so again, I know we're running a little low on time, but these are items, again, that you can discuss with folks who have DFN that you might be assisting. Find out if they need help with personal care. Would they be able to cope without water? Some folks have in-home dialysis machines that need clean water, and they've had to go to hotels to get that. Do they need a shower chair, transfer bench, Hoyer lift, other things? Do they rely on adaptive feeding devices to eat? And do they have a backup power supply for durable medical equipment? What would happen if debris blocks their exit or entryway? Are they reliant on a modified vehicle? Do they rely on someone to get their groceries or medications or things like that? Do they need assistance leaving their home or office? Can they reach in and activate an alarm? If they're in an office building, are all the exits accessible, say with an apartment building? Is there a backup elevator? All things that need to be looked at and dealt with ahead of time. They could work with building management to address any issues. Is there an evac chair on site to help them get out if there's no power for the elevator? Is there signage in print and large print and braille? Are the alarms audible and visible when the electricity is out? How will they call for help if they need to evacuate, what happens if sprinklers ruin their medical equipment, wheelchair, hearing aids, that happened to me, and what happens if you become separated from your mobility aids. If you're going to label things like even your wheelchair cushion or cane or whatever, use a paint pen. Other things tend to rub off in water. And we talked about that. Okay. Learn how to use backup power supplies. Okay. Have a generator on hand if needed. If you need oxygen, make sure you contact your supplier to obtain extra supplies and batteries and get a contact that you could reach out to during an emergency. That was a real problem here during Sandy. Have a medical alert system if you need to call for help and you're alone. Like I have an alert bracelet, and we talked about that. If you live in an apartment building or work outside your home, ask management what the emergency procedures entail. Program cell phones with emergency contacts and also have them on a piece of paper in your go bag. And let's see, make sure we have everything. Wear appropriate clothing based on the weather and safety factors. Always follow instructions from trusted officials, and that includes recommended travel routes. And inform your support network of your location and any needs you might have if you're evacuated. Practice giving instructions about your situation and any special needs in a clear and concise way. Inventory and insure any possessions you have. Like my wheelchair might be something I want to insure in case my house is destroyed in a fire or a flood or anything like that. Unit 6, how can CERT partner with the DAFN community? These are some of the groups that you could work with for advisory groups. Again, many counties have them, and they consist of emergency managers, first responders, disability advocates, COADs, Medical Reserve Corps, assisted living facilities, caregiver coalitions, fire departments, American Red Cross, county animal response teams, you name it. Okay, here's a video that I believe Anastasia is going to show. Okay, so that brings us to the conclusion, Unit 7. These are a few resources that might be helpful to you. Some have some great videos. New York City Emergency Management, New Jersey Division of Deaf and Hard of Hearing, and then I suggest checking out the other resources. I do have a resource guide that everyone will eventually get, and I'm happy to take any questions or comments for the remaining minutes. And I thank you all for taking part in this.
Thank you for your presentation, Kelly. We actually have almost 10 minutes for Q&A, but before I start doing that, Suva, would you like to talk to our participants, if they weren't on the call early on, about the upcoming CERT conference?
Yeah, thank you, Debbie. Well, first of all, thank you so much, Kelly, for your great presentation. This is the first of 6 in a series where we are kind of repeating the 6 most popular sessions during the 2022 National CERT Conference, and they will be every other week, I think. So if you were on this call, you should have received that flyer. If not, you can email me for the flyer for all the links. Kelly will also be doing a longer presentation on this material during the pre-conference training, so if you want to see a 4-hour version, it'll be during the pre-conference training. In California, we are working with Kelly to create a California version of this training, really taking her base materials and just adding on any additional guidance in California. If you are a California CERT program and want to help review that and provide comments, email me and we'll send you her materials to review. With that, I'll turn it back over and I'll include a link to sign up for the conference email list for people who want to get updates for the 2023 National CERT Conference. Thank you.
Thanks, Suva. Kelly, we have an individual who's working on an ANSI accredited national standard on inclusive terminology. It provides guidance on how we can engage in an inclusive way. They define people first and identity first language. But do you have any suggestions for determining preferences in emergency management, preparedness, and response?
To determine preferences in that field in terms of inclusive language?
Yes.
So there is the FEMA document, which I actually just sent out to one of my county AFN coordinators today, that perhaps, Debbie, we could get out to attendees after this, that I found very helpful. And I've also used, if you go on the Texas Council of Developmental Disabilities website, their People First Language document. It's a little bit more brief, but it's available in English and Spanish. That's a good one. It's available to the public. They've given permission to share. You can just download it in PDF format. But I do love the FEMA document as well. So Debbie, perhaps we can work together to get that out. I think it might be online too, and it mentioned inclusive language. Okay. That would be helpful.
Actually, I reached out to our disability integration advisor, and she just shared 2 documents with me, one on disability etiquette and another on language guidelines for inclusive emergency management. So as long as she gives me the thumbs up, I will ask Stacy to post them in the download pod today.
I think that would be great. And one of the things that I say when I talk to the disability community is please try to remember if somebody maybe uses the wrong terminology, but they mean well, you could educate them or maybe just let it slide. But, I do work really hard with our county AFN coordinators to make sure we're using the proper terminology. But things do change. It can be hard to keep up with. But I try to keep in mind when people mean well, that kind of thing.
Yeah, and I don't think there's anything wrong with asking, right? We recently hosted a webinar for individuals with loss of sight, loss of hearing, and a combined loss.
Mm-hmm.
And, you know, I wasn't sure myself. I mean, do we use the term deaf-blind? You know, what do they prefer, hearing impaired or, you know, vision impaired? You know, what's the right way? And I don't think it's terrible to ask someone what the best way is to refer to their ability or disability.
Yeah, and I've seen a few of the comments, and thank you for the kind words. I haven't caught them all, but I do appreciate all the kind comments.
Okay, I'm not sure that you really got into this, but did you talk about access needs for people with cognitive issues, such as dementia? They have an aging CERT cadre, and sometimes knowing how to accommodate folks with limited abilities in that respect can be challenging.
So I mentioned some tips on a few of the slides, but if you're dealing with an issue that's beyond that, I do work closely with the New Jersey Division of Aging, and each county, at least in our state, has an agency on aging. We have also worked with AARP, and they're always very willing to help. If I have a question, they're also willing to promote preparedness information. They reached out to their, you know, I want to say clientele, but folks that they served during the pandemic and other disasters to make sure they were okay. So if there's something you don't know, and you can't possibly know everything, you can always turn to the appropriate agency for help. Centers for Independent Living are helpful too. If they don't have the answer, they can direct you. And I'm always learning. It's ever changing, and so I try my best to keep up with what's appropriate, what are the new best practices. So don't be afraid to ask. And, you know, I'm part of a number of groups with some great subject matter experts, and don't hesitate to go to them. And I appreciate, Debbie, for what you and Stacey are doing to do monthly webinars to help us hone in on some of these issues and really understand them and how we can be more inclusive.
Thank you. Kelly, are shelters able to help get medications from pharmacies if people are showing up to the shelters without their prescriptions?
Yes. So some shelters might have a nurse on site who can fulfill a prescription. That's why it's also helpful to have copies of your prescriptions on hand if feasible. I carry actually have it. I have my little pill box that I bring with me. So let's say all of a sudden, okay, I have to evacuate right now, and I'm not home, I'm at work. I have enough in here to sustain for a day. That's an option. If, you know, you can keep your meds where you can just grab them quickly. There have been some very severe incidents in the past where John Dowd, if he's still on, Middlesex County, I believe, had to call in, gosh, I'm having a moment, but they had to call in assistance, I believe, from the feds to get medication brought in because it was just such a massive disaster. There is a great cost to the counties and states and such for that, but it can be done. I personally, too, recommend, I fill most of my scripts at a chain pharmacy because if one is destroyed, in my town, there's one on every block, so I can get it filled. However, some people like to fill them at a mom and pop because if you have to evacuate and you don't have your med, sometimes they might be able to give you a couple doses. I've had that experience too. So it's a little tricky. And some things I do mail order, but again, it can be tricky. But I am aware of those options all being played out. I hope that helps.
Yeah, and it's a matter of personal preference, but I mean, I could definitely be a cheerleader for the, the chain. A lot of times we get deployed, during Hurricane Maria, I was deployed, my deployment order said 7 days, and I ended up being deployed for almost 90 days. So to be able to go to a CVS in Puerto Rico, or Walgreens or something like that, it was just a matter of them pulling my script from the other location, which made it very easy for me. You talked about
write some comments too.
I beg your pardon?
Phyllis Worrell wrote some comments as well in the chat box.
Oh, okay. You talked a little bit about care assistance fundamentals class. Is that a national standardized class, and do you know where that might be available?
So I know, okay, so sort of a two-part thing. Red Cross does have a couple different programs. One is Everyone is Welcome, that we have them present at the in-person portion of this class. They also have an online portion, which I think takes about a half day. You can do it sort of at your leisure. We require that folks complete that online before they can do the in-person portion, which is scheduled on another day. They have to complete the online, have their certificate, then come to the in-person, which I worked with the Medical Reserve Corps and Progressive Center for Independent Living to create, and it's basically a variety of stations that will locate at a facility, and folks rotate between them. So they'll learn things like how to help a person transfer from a wheelchair to a cot, how to help someone who is blind navigate through the shelter, or perhaps even cutting up their food and saying, okay, your meat is at 2 o'clock, your string beans are at 7 o'clock, things like that. Also, one station we've had, I used to bring my stepsons, one who had autism, the other dyslexia and ADHD, and folks in the class would learn how to basically kind of help to keep them calm or to be able to work around their behavioral issues when they started to get frustrated because they've been there a bit and they're hungry. And I told them, boys, no tablets, there's no power. So they were great sports. They love to educate people on emergency management. But you could really get to see the behavioral issues coming out, and we didn't keep them there all day. It was just enough for people to learn how the behavioral issues could begin and how to best kind of address them.
Kelly, we are at time, and we do still have a few questions. If you're willing to stay on another 5 or 10 minutes, we can go through as many of them as possible if our participants are willing to bear with us. Our next question is from a CERT lead out in California, San Diego, if I remember correctly. My mom had some signs of dementia, but was able to function at home. When we had to evacuate, she became very confused. A year later, she was sick, no longer knew who we were. This might happen during evacuation. How might a CERT volunteer approach this topic with the evacuee's family member at the shelter, or what signs might they be looking for if there is a question?
I'm sorry, the last part was what
signs should they look for if there's a question?
Okay.
I guess questionable about their abilities, cognitively.
I know one of the things that we've implemented here, and I'm not sure if Sadie is on from Colorado, but there's a national state-level access and functional needs working group, and then also a national FAST group that's working on, in fact, that's probably more applicable, that is basically working on a template where the functional assessment services team, although we're thinking of changing the name, so would go into the shelter and assess people's needs. And that's where that would come into play. If somebody has dementia or perhaps even an issue with addiction or something else, they would meet with them, see what their needs are, and see, is it appropriate for them to stay in the general population shelter, or do they need a different type of accommodation, or can the accommodations they need be provided in that particular shelter? Again, they might want to place them in a quiet room area, perhaps call in somebody from, let's say, the Division of Aging to assist what the needs are. It's just they have a checklist of certain things they can go through to see what accommodations are needed, and if they're not on site, how would they get that? And do they need to move the person? I remember one year we did have somebody with that issue, and others, where they had to be moved to a nursing home. So I think it really depends on the level and the type of need. And then also, who's on site? Are there nurses on site? Are there trained medical reserve corps members who could help? Who's there to help? And hopefully that helps.
Thank you. Yeah, I think that makes a lot of sense. When you're bringing in a comfort dog, do you announce it ahead of time? It seems, some people are really afraid of dogs and might end up causing a stressful situation for them.
They should. Again, Phyllis, if you don't mind jumping in. Phyllis, when I visited the mega sites for the vaccine clinic mega sites, and again, I know it's a little different than a shelter, but they did have therapy dogs once in a while. I believe it was announced, or people knew what days they were coming, but Phyllis, okay. She identifies an area and allows people to come to the dogs. So yes, I did that personally. I went over to the dogs. But you didn't have to, and they stayed in a specific zone. So, that's one thing you could do if you're thinking of having them come to a shelter, but I would always put up a sign letting folks know.
Okay. So, in a shelter situation, if we ask two questions regarding whether the dog is a service animal and the person can't answer, what are the next steps? Does the dog go to an emergency shelter for pets and the person is allowed to shelter? A person needing shelter needs to find somewhere else to shelter that accepts pets. What other options are there? And then if a dog is clearly not trained, isn't potty trained or barks at people, do we remove both the person and the animal?
Yes, in that case they could be. We, in New Jersey, I started a service animal working group that is now kindly being chaired by Dr. Sandra Strelitz of the Department of Agriculture. So we really take a look at all of these issues in that group and have developed a guide for emergency managers on how to deal with those issues. It is tricky because sometimes even if you think a service animal may not be one, sometimes you have to err on the side of caution and allow it. But we do have certain subject matter experts that we can turn to in New Jersey to run the situation by them and get their expert opinion. We also, as I believe every state does, we have Disability Rights New Jersey, and we can also call them for free advice on how they handle a situation if it doesn't seem quite right.
And I think your dog agrees because she's very...
My dog is a good service animal, very destructive and not very helpful. But
but
so she would be booted out.
She's cheering you on. She's cheering you on. All right, I'm just going to do one or two more questions, and then we're going to wrap this up. Is there any liability for the shelter operator if an evacuee says their dog is a service animal, but it's really a comfort animal, and the dog bites another evacuee?
That, I guess it would depend on the county and the policies they have in place for that, which is really why you do need to keep an eye on the service animal. If you see odd behavior, then you really do want to separate them. Again, Phyllis, I know you want, if you'd like to comment on that. Let's see what he says. Okay, so yeah. I would really try to keep a watch on it, but in my personal opinion, it is rather obvious when it's a service animal. They're extremely behaved.
Okay. And my last question for today is there any inclusive symbology that you would recommend using?
Yes, and I'm just going to have one more thing, by the way. Always defer to your shelter manager if you are not the shelter manager on how they handle something. That should not have to fall on you in regards to the service animal incident. You go right to the shelter manager, and if they're not sure, they can call the subject matter expert. Okay, and symbols is what you're asking, Deb?
Yeah.
So there are certain things you could use. I would, as I sort of mentioned before, take a moment if you can and Google communication boards. I have actually specifically Googled emergency preparedness or emergency management communication boards. And if you are not sure if they are, compliant or proper, you can run them by the Office of Disability Services in the state you live in, or where I live, each county has one, and they'll gladly tell you if it's appropriate or not. I hope that helps.
Okay. Well, we did go over time. I did not get to all the questions. Stacy, if you could put the poll up on the screen. Kelly, thank you so much for taking the time and for turning on your camera to accommodate our audience. I do appreciate that. There is a short 6-question poll on the screen. If our attendees wouldn't mind taking an extra moment or two to answer that, that does help us drive programming. As Kelly mentioned, we are striving to make sure that we do at least one webinar a month that focuses on disabilities and access and functional needs, equity, civil rights. Those are all very important topics to inclusive emergency management. This on January 25th, we have a webinar coming up on Open. That's a great program for teaching small community-based organizations or small businesses, faith-based organizations, what is COOP, ultimately how to keep your doors open and your business operating. The FEMA Assistance to Firefighters grant, the NOFO, opened up. So if any of our listeners are volunteer firemen or women in their community and like to learn more about that grant program, it's great for equipment that's needed. And then we will have the FTC here doing a lunch and learn with us on tips to avoid scams that target our older Americans. So thank you for sticking with us, everyone. You are free to drop. Have a beautiful day.